Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Okay, welcome back, everybody. So this week I have Dr. Joe Sherman with us. So Dr. Joe Sherman is a pediatrician. He's in Washington. He is a physician coach, and we'll hear more about how he helps physicians in a moment. But he's also the clinical associate professor of pediatrics at the University of Washington. And I will let you introduce yourself. Welcome.
Thanks so much for having me. I appreciate it.
Yeah, thank you for coming. So you were practicing pediatrics and you were having a moment in your career, at least one, probably many, where things weren't going so well. Do you want to start there or do you want to start somewhere else? You let us know.
Okay. I'll kind of start, I'll start at that moment and then we can move forward and backwards. But I'll give you a little bit of context as far as that moment in time for me. This was about 2009, and I had just returned back to the US after living in Bolivia with my family for 4 years. And those were two young kids that when we left for Bolivia from Seattle were 5 and 3 years old. When we returned, they were 9 and 7 years old.
Mm-hmm.
So we had lived a life in a fairly rural area in Bolivia for 4 years. And I, at the time, was working as a volunteer. We were part of a mission organization, but it was really an organization that was interested in community development of living lives alongside in solidarity with people from other countries and really understanding the gifts that we each have in that exchange, in that living side by side. So for me, I was a pediatrician. I was teaching community health. I was teaching in the school where my children were going also. I was a consultant for an HIV orphanage that existed there. I also welcomed new people who were coming from the US to Bolivia and kind of a cultural ambassador, 1 foot in the culture of the US, 1 foot in the culture of Bolivia. And I thrived. I loved this kind of work. And I returned. We all returned mainly because it had been a long time. Our kids really, from an education perspective, we wanted to make these decisions to move them back here. Plus 4 years outside of medicine in the US, I needed it to kind of catch up a little bit. And I got a job back where I had been most of my career, which was a teaching position, working with mostly underserved populations of children, and in a community setting as well as a university setting. Mm-hmm. So I got a job which sounded like on paper was ideal for me. However, I realized after being in the job for a while that I was placed in this position which kind of boxed me in. I was to make this clinic run. I was the medical director of the clinic at the time, make sure that this clinic ran well, taught the residents well, that all the different people who were coming in to either precept the residents or the residents coming in that had their lives outside of the clinic, they showed up to this place and they wanted it all to be running efficiently. Now, the issue was that there had just been this financial crisis that I didn't hear about back in Bolivia, but as a result, half of our support staff was released or transferred somewhere else. So I desperately wanted to fix this problem that I hadn't created, but in my usual fashion, I took responsibility to make sure that I fixed everything for everyone else working around me. And I slowly sunk down, 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 because that was impossible to do. And eventually I became extremely anxious, depressed. I was putting my work ahead of everything else, including my family. Eventually, I ended up having to leave and step away completely. My wife, loving, generous person, was working part-time in teaching at a school of psychology. And then she went full-time, and I was kind of staying home with the kids while I tried to figure things out for myself. And what it was about Bolivia and other jobs that I had had in the past that really made me thrive, and the jobs that I sunk in, what didn't make me thrive. And as I understood this, I wanted to give it to other people. And that's how I kind of became a physician coach and retreat facilitator for other folks. So that's kind of a long answer.
No, that's a perfect place to start. I really like that. So there'd been a financial crisis and half the support staff had left. So you've immediately perked the interest of pretty much everyone listening to this podcast, because they're all like, me too, that's happening right now. So give us all the secrets. Okay, so the secret was don't try and fix it on your own, I think was the secret number one that we just heard from Joe, which is that really good, letting that one out of the bag right now. This is not the first time I've heard medical directors coming in and saying, oh, there's a problem, I need to fix that. So tell us, what did you think was going, like, how did you start to overdo it and sink yourself? So what were you thinking about the situation, and how were you trying to fix it that was really sinking you down?
Okay. So my personality is one of a people person. I love connection, community, all the C words are love, connection, community, collaboration, all of these different things. So for me, when I see people being downtrodden and depressed and feel stressed because they're called on to do things that were above their training level or taking on more work than they really were able to do, then for me, my compassion kind of went out to them as like, okay, I'll take care of this. I will protect you from the evil administrators and all of these people who are making you do these things. And I will protect you, and I will make sure that your experience here will be more compassionate and easier for you. As a result of that, I'll do the extra work. I'll go the extra mile. I'll take it on myself in order for you to be more comfortable in your position. So that's kind of, I took on the extra load.
Interesting. Can you give us an example of something you were doing that you'd taken off somebody else's shoulders, or how you were interacting with admin to try and navigate this?
Yeah. So let me answer the first question first. Just very typical thing. I would say during the course of a day, there would be, say there's a receptionist out front who's scheduling things and trying to fit sick patients in. And then there's the medical assistant in the back that's rooming patients, taking vital signs, giving vaccinations, all of that. And I see someone's busy or preoccupied. Oh, let me take care of that. I'll room the patients. I'll take care of the vital signs. Oh, I'll do the shots for you. You go ahead. You take care of that other thing. There's no room in my schedule to put that patient to fit that next patient in. I'll squeeze that one in. Just add them onto my list because it's important for me to see this kid because I know this kid really well, and I'll stay later and make room for that. So that's a very typical types of behaviors that I would take on.
Yes. Got it.
And then
okay,
as
so
far
you're
as
kind of the float, plus you've got your own panel of patients on that day.
absolutely, yes. Plus, teaching some residents on the side there too, and making sure that they have my full attention. So trying to do it all, basically.
Yeah. Okay. So do it all, do more, do all. Okay. And then with admin. So what was happening there?
Well, with administration, it was kind of this, it was that I was trying to be, okay, I can rise above this. I know I'm the physician and here's the clinic manager and everyone has banged heads with this person. I'm going to be the one that's going to make peace. Now I'm scared to death of this person because they really control my life and I don't know how I can somehow maneuver it, but I will make friends. I will negotiate. I will, because everyone else says it's the evil person. And I know that everyone is trying to do their best with what they have. So I would try to kind of advocate for everyone in the clinic. And then I would, again, work out with the clinic manager, and then I will take care of the rest of the things. So it was this kind of protective role, I would say.
Yeah. So the more and more you took on to protect others, the less and less of you time, I guess, you had left. What did that translate to in terms of your evenings, your sleep, your rest, your exercise, your anything else? Tell me about life outside of medicine, outside of the clinic.
I would say the one thing that was above and beyond everything else, I have to say, at the time, all of my charting was not a tremendous burden because not because I'm a whiz with the EMR or anything, because I wasn't. I was sitting there struggling over Epic, trying to figure out every new change that they made to make things supposedly easier, made it harder for me to find where it was that I was supposed to put something. So I was definitely struggling a lot as far as the EMR was concerned, but the volume of patients that I had was not that great because I did have other responsibilities. But I would take charting home. I would definitely be working on my charts at home. The other thing was that I was constantly preoccupied. There was part of my brain always preoccupied with how do I improve the clinic? How do I make life better for everybody? What about those patients? What about that family? How can I make sure that I didn't screw up with that decision that I made? All of these things. So I think it was more that I was constantly distracted from my family, from my wife, from my life outside of my work, because I was always under the idea and the impression that my work was my life.
Yeah. You're trying to be the problem solver, chief problem solver. What was home? Who were your spotters? What were people saying to you? Was anyone noticing what was happening to you? Because you kind of got to the point where you were like, I'm out of here. Who noticed?
You know, it's interesting because along with this, I would say that I was experiencing extreme anxiety and ultimately depression. It's kind of, there is this phenomenon amongst us anxious people that the anxiety takes such a toll on me, that as you run out of steam, then you manifest your anxiety and depression. There's nothing left. So in addition to being anxious about trying to make everything right, I also am an expert, left over from my medical school days, in showing my good face, making sure no one else knew that there was anything wrong with me, that I was struggling in any way. I was doing everything I could to kind of hold that in. So my wife knew, my family knew, people who were close to me knew, but I really didn't want to show those signs of weakness inside of me. However, I was, I did have a therapist. I did have people that I was going to and relying on, a therapist, a spiritual director, guide person that I would go to. So some folks were well aware of the struggles that I was undergoing.
Yeah, it sounds like you did actually have a good support team there. What does anxiety mean for you? What was your experience of anxiety? How did it kind of show up physically or for you? What does that look like?
It was something for me that's been with me since I was young. I definitely remember in medical school and residency, especially, there would be, in the clinical years, I would say, especially, I would put in all that time that we had to put in. And this was back in the early 80s. We had long call nights and long shifts. And for me, work was a treatment for my anxiety. So I would feel restless, indecisive. I don't know what to do with my time. I don't know how to make decisions. And so I would stay in the hospital, work more. I would go back and visit my patients after my work was over. And then when I finally finished residency and I went into my first job was a private practice job, all of a sudden I only had to be in the office from 9 in the morning until 5 in the evening. And I was on call once a week. What do I do with all the rest of this time? And I just was pacing in my apartment back and forth. What do I have to do? I have to find a social life again. I have to figure out how to relate to people again outside of work. And so for me, it manifests itself in restlessness, constant intrusive thoughts of what if, and yeah, but, and all of this second thinking, self-doubt and those types of things. That's the way it manifests in me.
Right. So when you're taking home all those clinic problems, the unsolvable problem, your brain could not get a break.
Exactly. Yeah. How to turn it off, how to say, well, it's going to be there tomorrow, so I'll let it go, be fully present to my wife, my kids, my life, and then pick it back up tomorrow. Boy, that sounds so easy just saying that, doesn't it?
It wasn't easy in the moment, though.
No
because
way.
like this is therapy, wife, close friends, spiritual aid, and we've got Joe just running down this plug hole, and then you leave. So that would have been a difficult decision, I'm going to suggest.
Ooh, I would say difficult and courageous. It was difficult for a lot of reasons, but courageous. And I would say one thing that did help me in that decision, well, one thing that helped me was when my psychiatrist said, would you bring your wife in for a next appointment? And I said, sure. And when I did, he looked at her and said, well, how are things going? And in tears, she said, not good. And I'm afraid I'm going to lose him. And he looked at me and he said, well, what do you think? And I said, wow, I think I better stop. I think I better quit. And his response was, how soon? And that was, I think, the ultimate wake-up call. But I had made many transitions in my career before, none to that extreme, but I had made the transitions before. So the idea of moving on was not terrible, but the idea to myself that somehow I was a failure at this idea that I could fix everything for everybody, that was hard to overcome.
Agree, right? So when your doctor says bring your loved one in, it's not normally a good prognosis. And did you have an inkling that was going to be a suggestion of illness?
I knew he was going to check things out with her. Did I know that I would walk out of that office having a quit date? No.
Right. Okay. So we had a clinical prognosis, a please leave this environment or it's going to kill you. I think that's wise to have somebody telling you to get out now. It's not good for you. Right. And then you've transitioned before, but you've never transitioned involuntarily, I guess you could say.
Right. I would say that was true. I had made many transitions in my career, and it's so interesting because after I stopped working at that moment in my life, I really wanted to spend time, first of all, recovering mentally, and then reflecting and exploring what it was that made some of my moments in my life and in my career really feel right, like the right fit. And when I go back, I have said that I burned out, But the reality is, as I look at it, I was misplaced.
Mm.
I was in a place trying to do something that was not going to work for me. And I did burn out as a result of that. But what was it about Bolivia that made it so wonderful? What was it about other jobs that I did seem to thrive in? And I
Mm.
was able to really examine that and to look with the help of reading some books. And like I say, I really surrounded myself. I added up my sangha of helpers expanded to more people, coaches and people in other professions who I went and interviewed to see maybe that idea of being a counselor or a teacher way back before med school wasn't a bad idea, or those types of things. Did I miss the boat here somehow? But I was able to understand that there were elements that were present in those times in my life that were based on my core values, that were based on either external limitations placed on me or my own limitations I placed on myself, mostly external because I wasn't very good at doing it internally. But it was kind of like, I'm sorry, in Bolivia, our clinic is closed now. You can't work anymore. I'm sorry, today's a holiday. You can't work. I'm sorry, all the taxi drivers are on strike, so you can't get to work. Sorry. So those types of things happen. And I understood that for me, spaciousness was extremely important. Having some time of nothingness, despite my anxiety, but nothingness where it was okay with me, or some spaciousness to spend more time with patients or more time with friends was important to me. Working in a team with connection and collaboration, so it wasn't all on my shoulders,
Mm-hmm.
but instead we shared this responsibility amongst other people. And we worked as a team, backing each other up, telling each other, look, you look tired, you go home, I'll cover for you. And being able to be in that type of environment and that supportive environment was what really made me thrive.
Mm. Mm-hmm. Back to that collegial community people.
Yeah,
Love
exactly.
it. Okay, got
Exactly.
it. So then where did that go then? So how long were you off work? What were you learning in that time? What did you decide was for you about sustainable? So what did you figure out was sustainably for you?
Well, one thing that happened was I read this book by Parker Palmer called Let Your Life Speak. And it was all about examining your experiences in life when you felt most alive, most yourself, most authentic, and then extract the elements of that experience to see where else in life those opportunities arise. And so for me, that exploration involved, like I say, talking to people in pastoral care, counseling, teaching, all these other things. But then it also helped me to say, where is there the possibility for me to be this accompanier, this person that likes to spend time with people, to get to know them in relationship in order to be of service to them. And there were some clinical places that I was able to go and work part-time. This was after about a year of this discernment. And then gradually I started to say, well, I'll work part-time here and I'll see what this is like. This is a clinic that gives 30-minute long acute care appointments and 45-minute well child checks. And so like, let me try that out, see what that's like, working with this team of like-minded people in this nonprofit clinic who have chosen to do it this way, make less money, but have more fulfilling careers. So that's pretty cool. Let me try that a little bit. But all along, I also had in the back of my mind, I want to help other physicians somehow be able to explore what they can do without reaching the point that I did.
Mm.
And so that's when I started to say, I want to become a facilitator for retreats for physicians. So I got trained as a facilitator with the Center for Courage and Renewal. And then I said, wow, people are coming to me individually after these retreats and saying, can you help me out? Can you talk to me just about my situation? So then I became certified as a physician coach and learned how to work one-on-one with physicians and exploring their core values and what brings them life. And how they can set boundaries and how they can have self-compassion to the degree that they show other people. And I say, every time I say they, me, we. And so that really became kind of a new passion of mine. And so that's how I ended up doing what I'm doing now.
Yeah, so true, isn't it? We're happy to give everything and then go inside. I heard one of the occupational therapists who I probably first learned about this improving our kind of mindset and looking after ourselves so well. She's like, you give and give and give, and then you go inside, you scrape off the lining and you still give.
Wow.
Yes. Hands up, all those out there who kind of give till you're done. So yeah, self-compassion to you and so yes. Love it.
Yeah.
So important.
Yeah. And so I think for me at this point in my life, I feel that as a physician coach and also working with groups, I love working with groups either in workshops or ongoing support groups. I facilitate a group with Physicians Anonymous where people can drop in who are really struggling with their work as physicians and just tell their stories and find support and to get out of this isolation that became so intensified, especially during the pandemic. So just being able to lean on each other and support each other during these times, and really to be able to, like I say, for myself, practice the compassion toward me, because I'm still a work in progress. I'm still that anxious person. I'm still that people pleaser. I'm still that really difficult to set boundary person. So I have to work at it every day.
So when you are in retreats with physicians, when you're bringing them together as a group, what were the sorts of things that you would be working on together in that space? How long would they go for? That sort of thing.
Yeah. So the kind of the cornerstone retreat that I co-facilitate with a clinical psychologist that I work with is a 4-day retreat, like a long weekend. And we go to an island that's off the coast near here in Seattle, in a beautiful place that's right on the water overlooking the mountains. And we spend some time with meditation and reflection early in the morning, but then we have a circle practice where we call it, from the Center for Courage and Renewal, call it a circle of trust, where people are going through their own journeys of reflecting on their lives, on their careers, what it was that brought them joy, how they can live that out best as leaders, as physician leaders, because the reality is every physician is a leader of something, informal leader, formal leader, whatever it is. So going through this process of listening to yourself, showing your self-compassion, being able to lead a reflective life, then you can actually pass that on to the people who work closest to you. Those people who are around you every day, your organization, you can provide a courageous space to listen to them, for them to tell their stories, for them to have input and take agency into how things are done that impact them on a daily basis. And we do a little kayaking. We do a little bit of enjoying each other's company and playing around a little bit in between, and some resting also.
Yeah, I think sometimes with retreats where there may be the physicians or clinicians who are scared that you're going to get them to leave medicine. Like you kind of had that big boomy, you must leave this job, it's not good for you kind of experience. I think that there's a fear there that the only way to stop this is to leave, right? The escape idea, the whole, like when I was looking for my own way of practicing more sustainably, the only physician coaches I could find on the planet at that moment were helping me leave medicine, right? That was the fear I had, was I have to leave this space And again, one, it's that fail piece. Like I'm worried I failed, and that's why I have to move on because I couldn't do this. But the second piece is they're going to tell me I have to, that's the only way to stop this is to leave the job space, right? So that's not, by the sounds of it, what's happening. You're really just pausing for a minute and saying, hang on a minute. What's your story here? Who's looking out for you? How can
Yeah,
you rest better? How can you be well? How can you find joy again?
I can't think of anybody that's attended any of our retreats that left medicine altogether. However, I will say this, that I speak for myself and the clients that I encounter. When we put our entire identities into being the doctor, if that whoever the prototypical doctor was on the TV show that you grew up with, for me, it was Marcus Welby, MD, or, maybe it's Grey's Anatomy or MASH or ER or St. Elsewhere, all these different shows that have been around. If you say that everything that I am is a doctor, then I believe that you are headed toward disaster. If you are able to say that being a doctor is a manifestation of who I am, it is a way that I manifest my values and how I want to be in the world. There are other ways I do it too. I do that as being a partner to someone in life. I do that as being a parent, or I do that as being a volunteer. I do that as being a gardener. I do that as being a singer. I do that as being an actor, or whatever it may be. Mm-hmm. Practicing medicine is one way that you manifest that. So when it becomes the only way and becomes everything, then if something goes wrong, you don't have anything else. That's your identity. So I do think that there is some reflection and some introspection that needs to be kind of readjusted a bit.
Mm-hmm. Yeah, that's so important. I think that I don't think I've heard it that way before, but you're so right. The practicing of medicine is the expression of our values or how we like to engage with others. Mm-hmm.
Yeah, and for me, I think that's one of the amazing things about my experience overseas. Before living in Bolivia with the kids, my wife and I lived in Uganda many years ago for a couple of years. And when I was able to see how I could come alive in activities that had nothing to do with medicine, and I was like, wow, this has a similar feeling that I get when I have this wonderful encounter with a patient. Wow, I can do other things that fulfill me. It almost gives you the freedom then to practice medicine the way you want to practice it and look for the ways that work for you the best.
So interesting. Yeah. So we're not just trapped there in that space. We can actually have that somewhere else as well. There we go. Permission to go find out where else you get your joy from, not just in the room with the patient.
Exactly. I was just working with a client today, and he had this aha moment. And so what he said, I was talking to a friend of mine who works for a home care agency as a chief medical officer or something. And she's very happy. And I never knew that anyone else, you could be anything but an academic physician, because that was the pinnacle of what medicine was. And so for me, that was the only way that I could be a doctor. And I realized that I've been judging anybody else doing anything else as a doctor. Wow, if I let go of that, then all these possibilities exist. Wow, great.
Yeah. Trapped by our own brains. Funny, isn't it? So I'm curious, going back to this cultural ambassador, that you loved being a cultural ambassador, right? When you were in Bolivia. And you would take people coming out of the States and you were like, this is Bolivia and here's how it's done here. And here's how you can have the best interactions, what were you doing about that cultural ambassador? What did a cultural ambassador in Bolivia look like? What were you doing to help them?
Okay. This is something I love to talk about because I still do it. I accompany groups of physicians to South America, to Bolivia and Paraguay, as kind of a cultural ambassador still. It's this wonderful experience of looking at the people who are coming from outside and saying, I've been there. I know what they're thinking. I know what their fears are. I know all of these things, but I want to listen to them and hear what their questions are, what their observations are. And then looking over here at this group of people and say, I don't know it all over here, but I have a pretty good idea because I've been living here for a couple of years, and my kids go to school with their kids, and I'm going to the same events and everything. I kind of have an idea of what it's like for them to look over here at this group of people and go, what the hell do they think they're doing? And to say how wonderful it is for them to be here. So to be able to have this perspective of this experience and that experience on both sides, and then to come together and to say, I'm curious if, as you are here and you are wondering why people here are acting this way, where that comes from, because it's not something you do. I'm wondering if you might want to know or ask this person over here where they came from or why they do that. So that's like, oh, okay. Would you be willing to tell them or explain why it is that you do things this way, or why it was that you were late for this meeting, or those types of things? And so it's this wonderful experience of seeing people come together by listening to each other and being curious about each other.
Mm-hmm. Do you feel like you have a similar role with physicians coming out of that space where they're feeling trapped and isolated? Do you think that's part of what Physicians Anonymous might be doing?
I think in that role, as I work with Physicians Anonymous, it's providing that space, that courageous space where people can come together and feel like it's okay to be vulnerable.
Mm-hmm.
When I work individually with physicians in my own coaching practice, or when I sponsor retreats in that setting, it's the same thing. It's kind of like, you know, something, there is the possibility of asking the question of what else is possible. What is it out there that would be the best fit for me? And to believe that it's possible, especially now where everything in healthcare in the States is getting tossed up in the air and nobody knows where they're supposed to be. So people are leaving and switching and changing jobs. And some of my clients, I encourage them, once you know what it is that really brings you alive, ask for it. Say, I've done this deep dive. I know what it is that will make me the best doctor in this situation. And I'm going to advocate for myself now.
I think that's really important. So you've walked both lines. You've kind of been in the thick of it. You've been on the other side where you're not working at all. You're kind of navigating the middle ground now. I think you have that ambassadorship to be able to help that navigation into both sides of the culture. And they're right. You're right. The impossible is becoming possible when we allow ourselves to let it. So infinite ways of doing medicine, infinite ways of doing our clinical day, and just that big step back and saying, what do I want? And then the courage, like you say, to step forward towards it. And it's going to be messy, the messy middle, as we know. We talk about the messy middle all the time around here. Okay, so if people are feeling stuck, if they're feeling overwhelmed, if they're feeling perhaps they're in that space of burnout, it's unsustainable, I can't keep doing it this way, where do you start? So what are your kind of take-home ideas for those people?
The first thing I think is to have the courage to admit to yourself that things aren't going well. And then to let go as best you can of this idea that somehow you cannot admit it to someone else. So you have to admit it to yourself compassionately, and just imagine if one of your patients were coming to you and saying, my work is driving me crazy. I'm so stressed out. I have hypertension. I'm anxious. I don't know what to do. What type of advice would you give to that person who is coming to see you? So it's acknowledging it to yourself and then reaching out for some help, because we have this perspective of things that somehow has become distorted over a period of time. And so reach out to someone you feel comfortable with. And it could be a friend, it could be a therapist, it could be a coach, it could be anyone. But be cautious, because there are those people that we've surrounded ourselves with who are our cheerleaders. And the cheerleaders are, come on, Joe, this was just a temporary thing. You can do it. Get back up on your horse and get out there. We need you in the fight. Be careful of people like that, because they mean well, but somehow they just have you perpetually in the same situation. So reaching out for help, admitting it to yourself, and having the courage then to follow through. I think if you find the right person, a coach that has experience, therapist that has experience, or a friend that you can rely on, then it's having the courage to keep taking the next step and be compassionate for yourself when you fall short.
Yeah, I love that. Compassionate for yourself. We're not supposed to know all the answers, but sometimes we need a different perspective. If we're just in our own head, sometimes it gets really weird to try and figure out the way out. All right, where do people find you, Joe, if they're looking for more information?
Sure. So I have a website. It's joeshermanmd.com. Very simple. My name, joeshermanmd.com. And you can contact me directly by email, joe@joeshermanmd.com. And there are a bunch of resources and explanations about my services on my website. There's also an opportunity to schedule directly a free consultation with me. We can chat for 30 minutes about your situation and see what the best course of action is for you.
Love it. And then anything we didn't talk about that you'd like to just mention or talk about?
I just say, I want to thank you for the work that you're doing, because I have to tell you that the charting and the in-basket and all of that stuff is the bane of everyone's existence right now. And just to provide somebody freedom from that, just to have some spaciousness from that, it just brings in all kinds of possibilities of what else you can change and improve in your experience of life. And that work is only a component of life.
Yeah, we certainly don't want to be creating that second job for ourselves in the evenings that we really don't enjoy, because there's no people involved and we're missing out on all the fun things. So yeah, good. Well, thank you so much for your wisdom and for your compassion for other physicians and for your work in this space too. So I really appreciate having you here. So have a great day, everybody. See you next time. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.